Tips with me, Patricia Rockson Hammond. As usual, my guest is Dr. Sefogah. He's a consultant, obstetrician, gynecologist with Sheep Health Care. He's also a senior lecturer at the University of Ghana Medical School. Today we're discussing infertility. Welcome, Doc.
Thank you very much, Patricia.
Thanks for always being available for me for these discussions.
Available for you and for our people. Thank you. It's a pleasure.
So we're talking infertility.
Yes, we are.
Yes. So please educate us.
Yeah.
What infertility is and who is at risk?
Yeah.
What causes it and can it be treated?
Sure, certainly it can be treated. So infertility basically refers to the inability of a couple to conceive after they have been together for 1 year. Okay. But if the woman in that couple is 35 years or more, then we don't wait till 1 year before we say, no, there is infertility.
The age is always 35 years.
Yeah, we use 35 because by the time the woman is 35 years, her egg load has reduced. And whatever is left reduces rapidly compared to previously, right? And again, the quality of the eggs begin to decline sharply compared to before, which is why ideally, the woman should prioritize her childbirth and be done by or before 35. So you ask, what are some of the risk factors or the causes? If you take 10 couples who are having difficulty conceiving, 3 of them, the problem may be solely having to do with the man. Another 3, it will be solely a woman's problem. Another 3, it will be combined. Okay? And the one, which is the 10%, they are what we call unexplained. You're unable to tell exactly what the cause is.
That's what we can say is spiritual.
Yes, why not? Okay? And so, when a couple has the difficulty conceiving and they come, then we need to take them through the various investigations. Whether the woman has been pregnant ever before, in which case we call it secondary infertility because she's been pregnant before. Compared to somebody who has never been pregnant her whole life, we call it primary infertility. Okay? So then in looking for the causes in the man, fertility function in the man revolves around how well or how good the sperms are. Okay? So for the man, the simplest thing we do is what we call semen analysis.
Okay.
Where we're going to advise you to abstain from sex for 2 to 5 days, and then we take your semen and then we analyze it.
Does that also have to do with the age?
Not so much.
Because men are free.
Not entirely free. In men, it's after 50 years that sperm production begins to go down compared to the women in whom it's about 35. Okay. So we look at the seminal fluid or the semen. We analyze it. The semen is the fluid that comes when a man ejaculates. So we need to see the living cells, which are called the sperms or the spermatozoa, inside the fluid. There is a set number, minimum of 20 million to see, then we know that, okay, this is good per male.
Okay.
If it's below that, it means there is a low sperm count. Occasionally we do that, and the whole of the semen has no sperms at all.
Wow.
That's what we call azoospermia.
Okay.
Is that okay? And if we see that, then we investigate further. Is it like this man is not producing the sperms, or he's producing, but it's all stuck in the testes and not coming out? And depending on what we find, then we address it.
Okay.
Whatever it is, there's a solution. Okay? Then, in terms of the woman, the problem of not being able to conceive could be at a level of the ovary, where the woman releases her eggs from. It could be at a level of the tubes, because when the eggs are released, they're supposed to travel through the tubes. Okay, that's what we call ovulation. And if around the time of ovulation the woman has unprotected sex, the sperm is released here. So like I said, the sperm has to be plenty enough and also have the ability to move so that when released here, they can move up and it's attracted to where the egg is.
Yeah.
Because if 1 month you release it, this month you release your egg here, next month you're likely to release it here. So the sperm is able to get attracted to where the egg is. It meets the egg halfway, fertilizes it, and then this fertilized egg, which we call the embryo, moves down again to settle inside the uterus and grow into a baby who we shall welcome after 9 months. And we have a party to do the outdooring.
Okay. Is there a way to test my fertility?
Yes, so like I
Before
said,
35 years.
certainly, because what happens is that majority of women who have difficulty conceiving in our part of the world, the problem is having to do with the tubes. Most of them have issues with the tubes. The tubes are blocked.
Okay.
And that may be because of a previous pelvic infection they may have had. They may not even have been aware about it. Or somebody may have had a previous pregnancy termination which was not safe. Okay? If a woman gets pregnant and they don't want it, they're supposed to go to an accredited facility where the termination is done for them and they are given antibiotics to prevent these things. But people do terminations without appropriate supervision from a trained provider. And then complications can arise that will damage the tube.
Okay.
Okay? Occasionally, people have fibroids that can just be the
cause of
problem.
infertility.
Okay. So, we do a test to see how much is your egg reserves through a blood hormonal analysis. Yeah. And we do a test to also see if the tubes are blocked or not.
So that is done, what is that? You have to undergo a scan to determine if the tubes are blocked.
Yes.
Or has to be blood.
No, it's not blood test. It's a special type of scan. Whilst we are doing the scan, we inject some solution to see if it's going to flow through the tubes or not.
Okay.
Right? And we see it flow through. So if there's a blockage, then we try at the same time to see if we can flush it open.
Okay.
Then it
So I
becomes...
think that's what most people refer to as flushing of the womb, the uterus.
Yes, to some extent, yeah.
Okay.
Occasionally, the problem is not the ovaries, it's not the tube, but the problem is with the womb itself. One of the commonest is the fibroids, like I've said. Occasionally, we also have some tiny growths inside the lining of the womb we call polyps. When they are there, the pregnancy cannot settle there.
Polyps are different from fibroids.
Yes, they are. They are much smaller. But because the egg, fertilized egg, is very tiny, those polyps have the tendency to interfere with the egg implanting.
Are polyps also, is it polyps? Or?
Yes, polyp, Polyps.
Are they also infections?
No, they are not. They're just abnormal, tiny abnormal growths.
Just like the fibroids?
Yeah.
So is it possible that you have the fibroids and you have the polyps?
Oh, yes, it is. Yes, it is.
That's not fair.
I know. But so we look out for those things so that if the woman has any of those, then are they likely contributing to her inability to conceive?
Okay.
If yes, then we need to remove them
So
in order to make way.
Okay.
Right.
So we first check the tubes to see if they are not blocked. We check the uterus to see if there are no fibroids blocking the way or polyps. Wow.
Okay. And of course, we do the blood test to check the hormones.
Okay.
Because one of the other common problems is hormonal imbalance. There's a condition we call polycystic ovarian syndrome. We'll discuss that sometime later, where there are tiny growths in the ovary. And as a result of that, the ovary produces higher levels of male hormone in a woman. And that ovary does not really ovulate. And so she can't get pregnant. And the woman develops beard because she's having higher levels of male hormone. They tend to have a lot of acne. They put on weight. They have hair on the chest, hair here, hairy legs. And so if a woman is having a hard time conceiving and we examine and she has those things, then we know that that may be pointing to that condition called polycystic ovarian syndrome. And then we put her on appropriate medication, including weight management, to deal with that.
Wow.
Sometimes one of the hormones we call prolactin may be too high. And so the woman is seeing milk from her breast.
Even
When
if
she hasn't got a baby and she's not lactating, she's not supposed to be breastfeeding. Because the level of prolactin is too high, that is why she's not able to ovulate. And so if that is the reason, and then we give medication to deal with that. So we do all these investigations looking for the possible reason why she's not conceiving. We find the cause, we deal with it, and then the pregnancy comes.
So I'll be right to say that you're supposed to test to check if you're fertile before you get married. Is that right? Or?
So there are ethical reasons. So if you check, assuming you're in a relationship and you came to check and there is a problem,
Then you treat it.
so not everybody will take that lightly. Yeah. Somebody may end up losing their marriage, their potential marriage. Do you understand? So let's do it this way. When you're married or when you're trying to conceive and for about a year it hasn't happened, don't wait further. If, however, the woman is 35 years or older, 6 months, if it hasn't happened, come and let's check so that we can correct whatever may be wrong. It is okay that when you're married and you're planning to conceive, you can have a consultation with your doctor, with your gynae. That's what we call preconception care. That's extremely important so that in case you need some supplements or you have some medical condition that will require some medications to prepare you and to make your pregnancy safe, you're overweight, you're diabetic, you're hypertensive, so that we can optimize you before you embark on the pregnancy journey.
Okay. Because I was told that when you're planning to conceive, anxiety shouldn't be part of it. So would it be right for me to say that anxiety can also cause infertility?
Yes, to some extent, when
everything is okay, but it's just the anxiety.
Yeah.
Expecting it.
Because when you are so anxious, you are stressed, your body produces some stress hormones. So the stress hormone would suppress your fertility function. Because the body says, I'm stressed. The body feels stressed if it thinks it cannot overcome a particular circumstance.
Okay.
So in that state, the body reproduction is not a priority for the body. So the body will shut fertility function in order to survive the stress. So we always encourage couples to take it easy. Do whatever you can do to let off your stress. Watch a movie, go for a walk, go for a dance, sit at the shore, watch the waves, watch comedy. Have a way of easing your stress and try to keep it normal. If it's not happening, see a professional.
We spoke about some of the causes of infertility, the tubes blocking, checking out the hormones, the polyps, fibroids, the sperm.
Yeah.
So after analyzing, checking and seeing all of these things, how then do you treat it?
Yes, very good question. So when we're able to figure out the cause, then it's about dealing with the cause. For somebody, they just do not know what time of the cycle they should meet. That is why they are not getting pregnant. So this will be a matter of counseling them that, you're ovulating, okay, your tubes are good, the sperm is fine. So when your period starts from here, you count this number of days and make sure you meet 2 or 3 times over these 2 or 3 days. Problem solved.
Okay.
Another person is not really ovulating. So just some medications at certain time during the menstrual cycle. Typically, we may start them from the 1st to 5th day of the cycle and then tell them when to have sex. Another person will give them the medication and then ask them to come back so that we do a scan to see whether she's really developing eggs. And based on that, we say, okay, we've seen the eggs, so go and have sex on this number of days.
Okay.
And that's it. Others, the sperm is low. We need to give the man some medication to improve it. Very occasionally, there's something wrong with the testis, which is why the sperm is low. Either the testis is being exposed to too much heat. The man works in so much of a hot environment, or they wear very tight underpants, which squeezes the testes to the body. The testes are supposed to be lower than the body so that they don't operate at the same temperature as the rest of the body. Okay. So if you squeeze it to the body, the temperature of the body affects it and it doesn't work well. And so there's some other condition where there's too many veins around the testes. the blood is warm, and that also affects the function of the testes. So if we see that, some minor surgery correct that, and in majority of them, sperm production will pick up, and then pregnancy would happen.
Okay.
Yeah. And then the others that have more complex issues, then we have what we call the assisted reproductive technology.
Okay. Wow, a whole lot. I think we'll have to do a part 2 of this in our next episode of Infertility. My name is Patricia Rockson Hammond. It has been Health Tips, and my guest has been Dr. Promise Sefogah. He's a consultant obstetrician gynecologist with SHIP Healthcare. He's also a senior lecturer at the University of Ghana Medical School. Until same time next week, stay blessed.